Yeah, thank you very much, Ready for the systematic review of the situation in Kenya. I think now we have a much better perspective, although we know as people in Mashinani, they say you have the field, but at least now we have some numbers that we can work with. Next we will watch a short video that will give us an international perspective. The only video we will get is on the situation in Europe. So we will please watch a 10-minute video and to get what the situation in Europe is.
Emanuel Bondevic, then Prime Minister of Norway, broke this taboo and brought the subject to international attention.
Yes, I was increasingly feeling sad all the time during the summer 1908. I had lack of sleep, even small problems were seemingly difficult to solve. I got a feeling of anxiety and this made it even more difficult to sleep.
Attending a recent conference in Brussels, Together for Mental Health and Well-being, Mr. Bondevic shared his painful experiences with the other participants in a moving speech. The conference was an initiative from the European Commission, bringing together politicians, scientists and all other stakeholders involved in mental health in Europe from different perspectives, such as the medical, educational, social and economic one.
If you look at lifetime history, it's more than 25%, more than 1 in 4 people will have an episode or a disorder of mental health.
When we think of mental health problems, we first of all think of them as health problems and therefore will have an impact on the health systems and the costs of treatment. But they're unusual. Mental health problems are unusual, having a very wide impact. They have an impact on people's ability to work, their need for social support, their need for housing, impact on criminal justice and education.
In 2004, for example, the cost was estimated at 118 billion euros for all member states. Through an exchange of government policies, good practices and projects in progress, the conference was able to gauge the size of the issue, and it also marked the launch of the European Pact for Mental Health and Well-being.
The European Pact for Mental Health and Well-being is a symbol of the determination of the governments and stakeholders involved to work together to promote mental well-being and to tackle the challenges resulting from mental health problems. Through the Pact, we will highlight successful initiatives and results from research from across Europe.
The Pact identified 5 major themes: youth and education, older people, stigma and social exclusion, well-being at work, and the prevention of depression and suicide. Governments and actors in the health and social sectors, in schools and at workplaces are now encouraged to implement the Pact. So what's actually happening on the ground? We went to Budapest to see an example in the field of prevention of depression and suicide. In the early 1990s, the socio-economic situation created a lot of depression in the population. As well as the stigma attached to depression, what makes things worse for people in a fragile mental state is the lack of information and networks to deal with it.
Rendkívül súlyos egzisztenciás problémákkal kezdődött. Én akkor még nem tudtam, hogy ez micsoda, csak azt tudtam, hogy nagyon-nagyon nem én vagyok, és nem szóval rosszul érzem magam, és különböző problémáik úgy lelki, mint fizikai problémáim is sorban jöttek.
Nagyon fontos a magyarországi depresszióról való ismeretek oktatása, ezt mind pszichiáter is mondja, hiszen nagyon sokszor látjuk azt, hogy mire a betegek megfölkezelést kapnak, akikre már 100 helyen is jártak.
The issue is clear. It's vital to spot depression quickly to treat it effectively. It was with that in mind that the Semmelweis University in Budapest joined the European Alliance Against Depression, a network built up with the support of European public health programs and which brings together 17 European countries.
Az EAD program Magyarországon 2004-ben kezdődött, az egész EAD 2004-ben kezdődött, és Magyarország már az első körben csatlakozott hozzá. Ennek a programnak az elsődleges célja a depresszió felismerésének a növelése, illetve a depresszió destigmatizálása volt.
The European Alliance Against Depression works on 4 different levels. First,
I would have asked for help a lot earlier. I may not have got so ill. So that is very important that we look at this stigma around mental health and not coping at work.
In response to such difficult personal situations, the company has implemented a series of projects related to well-being at work. This includes training of managers.
The course is made up of some education to make sure people understand the basic issues, some examples to bring the issues to life, some role play to give people confidence on how to deal with the cases, and Q&A sessions to make sure that there's an opportunity to ask questions if the issues weren't clear or hadn't been covered.
And that really did help maintaining that contact with someone who really was aware of what they could and could not say and how to talk about the subject.
Other workplaces have engaged similar activities, and CSR Europe, a network which gathers several major European businesses, has created a work group on well-being in the workplace. There's encouraging evidence that improvement is feasible. Growing interest in mental health can also be found elsewhere. Health professionals and schools are increasingly active to promote good mental health and to tackle mental health problems. Several initiatives have received funding from European Union programs. The European Pact for Mental Health and Wellbeing helps governments and stakeholders to pool and learn from successful examples from across the European Union. In this way, the Pact contributes to the well-being of European citizens.
So I think this is a good juncture where we will take a break, and we will, as we go for a tea break, we will request that because we want to involve the stakeholders in trying to formulate a way forward. As you go forward your tea break, on your you have a sheet of paper from your experience, from your profession. You write 3 issues that are of most concern to you in your workplace, in your experience towards this field. So if everybody will come with 3 issues that are most pertinent, and then we will analyze them in the next forum, and then if you could write them during the tea, and then they can be given so that we save time. During the tea break, when you come back, you can leave your note there with your 3 issues, and then the secretariat can complete it well, and then you can analyze them in the next forum. Thank you very much. The number of persons times 3, we have those number of issues here. And then we will analyze them. We will use an analysis method called 5Ms. 5Ms, if I can explain briefly, it categorizes issues and problems into 5 major categories. We will categorize the issues that deal with manpower. Manpower will be probably on 2 issues: availability of people and availability of people with skills. There may be people, and then there may be people without skills, and there may be people with skills. So all those will follow under manpower. And then the second M will be on materials. Materials are things that you use for example, in a hospital, bandages, medicine, and all that will be under materials. And then the third M will be methods on how the process is conducted. If there are problems in the method, how the work is done, it will be under methods. And if there are issues of equipment, motor vehicles, machines, X-rays, etc., they will be under machines. And finally, we know money runs things. The fifth M is money, to pay for maintenance, to pay for salaries, to pay for allowances, etc., etc. So once we have your issues, we will categorize them in a summarized way too, so that we can realize that what actually is what actually are the main issues. But the main issues is any questions so far? I hope we are together in that regard. Thank you very much. Some of us still continue to consider the issues that we want to raise, the 10 issues. I think we will to save on time, and we we'll go on. We have requested some of you, especially the technical people involved in these issues, to speak to us on 10 minutes on trends. Probably, who would like to go first? You can take this time to listen.
My name is Salome, as I had told you, and I work for an organization called Kamili Organization. I'll take some few minutes to tell you what is Kamili Organization and what it does. Kamili Organization is an NGO that specifically deals with mental health alone, mental health and epilepsy. So it was formed in 2007, and it took over from Basic Needs, Basic Rights, if some of you know that NGO. After Basic Needs, Basic Rights had sensitized the community about mental health, and they had taken them to specific clinics, and then when the funds for B&K ran off, they left the patient hanging. By then, my boss, who is Melanie Blake, and I were working as volunteers with B&K. So in 2007, we registered Kamili Organization, which is a Swahili word meaning whole, Kamili. So Kamili Organization has been since then, and here in Nairobi we have 3 clinics. We have one in Lower Kabete, at Lower Kabete Dispensary. We have another one in Kihara Sub-District Hospital, and we have another one in Kangemi Health Center. So in those 3 clinics, we have over 3,600 patients in our care. So that's the patients that we are catering for. So at Kamili Organization, we do counseling, and we also do occupational therapy, and they get psychiatric review for free. So I had already said that one of the issues that with Kenya is that there are no professionals or enough doctors and enough psychiatric nurses to treat the mental health patients. And so 3 years back, we realized that because of our intense intervention in mental health, people used to travel very far distances to come to our Lower Kabete clinic. And so we started what we call the Nurses Scholar. The Nurses Scholar aims at, in a Kenyan setting, nurses are trained as general nurses. And so the Nurses Scholars target the general nurses to train them as psychiatric nurses. And so we train the general nurses into psychiatric nurses at Mathare for 1 year. We give them special sponsorship for that. And when they get sponsored for the same, they'll go back to where they came from. Like we trained one Mohammed from Moyale, a person from Nyeri, and from all over. They'll go back to their community so that those people will not have to travel all the way from their areas coming to Kamili to get treatment. And so far we have 11 such nurses all over Kenya, and we are training 10 more. So by September this year, when they finish, we'll have 22 satellite clinics all over Kenya that we try to make mental health services accessible to all Kenyans. So as per the data, what Suleiman is asking for, ours we don't, at Kamili we don't, I don't know whether to use the word advertise. We don't advertise what we do, but all our patients, we get them by word of mouth. Initially, there were very few because at 2007, we had around 100 patients. Last week on Thursday, we had 8 new clients on that day. And so the numbers are increasing on a daily basis. And sometimes we even feel overwhelmed by the number of the new patients that are coming, owing to the fact that sometimes we get very little or no support from the government. But we try our best, we sensitize our community, and we work together as one. Currently, we are working very closely with Mathare Hospital, and in what they call, we noted that in Mathare there were so many mental health patients who had been there for ages. They've been treated, they've recovered, but they don't have a way to go home and help. Exactly, that's the word that I was looking for. Abandoned patients in Mathare. And our social work department at Kamili Organization is relocating them to their areas. And before we do that, we are doing it differently than the way Mathare does. because we go to the family, because some of those people who abandon their patients, they abandon them because they know very little about mental health and even the care that they should give to that patient. So we go to those homes, psychoeducate them or teach them on how to take care of their own and how to know when they are getting unwell, teach them on the medication and how to ensure that their patients are consistently getting the drugs so that they can be well for a long time. And so that's what we are doing currently. Today, if you went to Mathare wards, it will show you all our nurses, the Kamili nurses, and the locations. If someone is in Muranga, it will tell you you'll go to Muranga, you'll find Obadia, and this is the number that you can get. So that we can ensure Kenyans that they can get mental health services in their areas, in their home states. So that's who Kamili is. I don't know whether I've answered your questions.
Yes.
So thank you, ladies and gentlemen.
Good morning once more. I don't know whether it's morning or afternoon.
Good afternoon.
It's afternoon already. Yeah. Picking from Kamiri, who are our partners. I'm Elias Kikundi, and I work with the Kenya Association of Professional Counselors as a counselor, a supervisor, and a trainer in the programs. First, may I introduce KAPC, who KAPC is. KAPC is an NGO, just like Kamili, and a training institution at the same time. KAPC has been around for the last 25 years, from 1990 to date. And our mandate is largely on the development of counseling, counseling services. Counseling in relation to training of counselors, which we've done over the years at different levels, certificate programs, diploma programs, EA with the 2 universities in the UK. That's Durham University for some time, and Manchester University up to date. And an MA program, which is coming to an end. We have also done with those 2 universities for the last 15 years or so. We also have a host of professional development programs in various contextual areas, and working with EU mentor area sector is one of those contexts that we work and struggle with and consult quite closely with the community. And I wish not to go through all the other contextual areas that we work in, which include the supervision, it includes stress, trauma, family relationships, drugs and substance abuse, and quite a number. The other area we work in is the area of membership. KAPC, the NGO side, is, as an association, it has a membership side of it, which conducts counseling services as well as workshops and seminars for counselors and the society in general, and conferences. We've been conducting a counseling conference over the years annually, and which has attracted quite some participation, both locally and internationally. Research is the third, our third arm, and we have conducted quite a number of researches which are peer reviewed and published locally and in a couple of international journals. And lastly, it's adolescent sexuality and reproductive health, which is an area we have worked in programs over the years, in the last 25 years, particularly publishing a newspaper, which most of you must have come across. It's no longer in publication. Straight Talk, which was in circulation in schools and adolescent centers around the country for a period of 13 years, from 1995 to last year, until last year. And key among the areas of our focus and attention for a long period of time, of course, HIV/AIDS area was one of our key areas of work in all those programs, both in training, in the association workshops, seminars, and other programs, as well as in the work with the adolescents and research. A number of our researchers were focused on that. But just as Mugambi was mentioning earlier, I think in the recent past there has been a downward trail in relation to funding support in the HIV/AIDS sector. One of the things that we are quite aware of is the mental health challenges that arise out, emanating around the HIV/AIDS area, and there is a very low understanding of the actual mental health issues that arise around that. Very little funding and very little support for a lot of people who suffer from mental health issues in relation to HIV/AIDS area, because of the stigma and the discrimination that surrounds that. People associating HIV/AIDS sector with sex, and the sex which is not in good order. There is a tendency to over-stigmatize. We have worked in the mental health area for quite some time, and what key challenge that we have observed working with in partnership with people like Madare, a host of a number of hospitals, and the organizations like Kamiri, who we work with even right now directly, is one, there is a very high level of stigma associated with mental health disorders. Two, very little research or funding support that has gone into that area. So you find that even very few of our students specialize in their researches finally on actual mental health issues. Even trying to find out how mental health patients can be supported at the community level, within the family, or even the government policies and the laws supporting that sector. There's very little research that goes into that as a result of the lack of funding. So that's one of the areas that we work with, but there is very little understanding. There are a number of issues which are of concern to us time and again, and that includes adolescent sexuality and reproductive health, issues pertaining to socio-emotional issues arising out of the various distresses that we have in the society. And one of the key distresses which we work on a lot is the election violence, 2007, 2008, and to date I doubt if there is somebody, or at least I've not come across somebody who conducted a good study to look at the impact on mental health of the Kenyan society, or particularly the people who are in the electorate are affected, since the entire Kenyan fraternity was affected, but there are those who are so directly affected, losing loved ones and going through experiences that were traumatizing for life. I am yet to come across a study specifically looking at the impact of that on the mental health state of those people in Kenya. And it's something that should be of concern to all of us who are working in the mental health. Gender-based violence is one of the key areas also which we look at quite a bit. Trauma arising from various incidences, right from the American bomb blast of the American embassy in 1998 to the plane crash in West Africa, the KQ plane that crashed in West Africa, to Westgate, to Garissa, post-Garissa experiences, and in many other instances that may not have attracted as much publicity, but do occur on a day-to-day basis. There are so many traumatic incidences that Kenyans go through every other day, and we need to look at that in relation to how healthy our society is. There's the whole issue of professionalism, which is a challenge. What's the level of legal framework supporting the mental health practitioners? And as counselors, we would be concerned with that in relation to practitioners licensed. Are they registered with some substantive professional organization? Do they have some levels of accreditation which ensures that they are practicing at a certain level, which they are competent and capable of delivering their services? So that's one area which we struggle with quite a bit, and we are working on it. Also, areas that Ileni presented is still touching that, particularly alcohol, drugs, and substance abuse, sexuality and reproductive health, finance management issues, workplace management, workplace issues pertaining to counseling, and that one is growing in relation to employee assistance programs, and it's an area which should be of concern to every other employer, because if the employees are not healthy, if they are not mentally well positioned to deliver the services, then even the services that they are delivering will not be commensurate with the expectations. Well, management is one of the areas that is coming up as quite an important key area. Issues of homelessness, family relationships, and lastly, media. Media is one of those important components of our operations, but also with its own pertinent challenges, particularly the coming of the social media, internet, and cybercrime, particularly in relation to children. There's a lot of cybercrime targeting children, and which has a ripple effect in terms of the mental states of the society that we are coming up with. And those are some of the key areas that we find ourselves concerned with time and again, and we are working in. Thank you.
Thank you very much, Bwana Elias. We will probably have a different angle. We can have St. John Ambulance. They work in different sort of scenario. They can give us probably a few words.
Coming from St. John Ambulance, as a reminder, my name is Henry Akunda. So one of our core things in St. John Ambulance is all about trainings and rescue services that we do offer. So in trainings, a variety extensive of first aid, 5 days, 1 day, 3 days, and more extent of nine months of emergency medical technician, dealing with basically the patient. And in terms of rescue, that's why we have some bit of problems whereby our rescuers go to tackle these different cases of mental health illnesses, and then they come back maybe some injuries, so that they found from that is the patient's status. So in that end, we believe in this particular forum going to get at least some aid in trying to understand the situation, because I believe in medical setups, things do change on how we approach them. Maybe the way we know, we need to add some bit of input in our knowledge so that we can be able to understand how do we manage them, how do we approach them on that end. And also in part of our trainings purposes, a question do arises from all our students, because they believe we are now maybe the leading training provider in these emergency things. So getting some knowledge on different inputs on even the mental health practitioners that are here to help us in trying to answer some questions that we do find. Others are receptive, they don't want to share it out, yet they do have more of these patients who they do hide in their homes. So it's more important that at least we can give directions, because if a student asks a question, they want a direction from your end. Maybe others do come because it's more so a voluntary organization, so they do come to ask for a certain help. So in this particular time, we can get some different help so that we can be able to direct them to a specific organization, maybe to a specific particular end, that they may get these services not only at a fee, but also others who can be willing to give them in a free service as a start, and then they can guide them on how to move on this particular end. So those are the few challenges that we may find here and there. Thank you very much.